Today, I will present on veterans' health and mental health. But before, this is the outline I will be following. Before I get into the health and veterans, I will, of course, provide the Canadian context. And it's actually good. It will situate the findings and what I'm talking about. I'll also talk about the epidemiology of Canada's military veterans. Then I will proceed with transition and well-being studies. Then I will focus on ill and injured and how they are transitioning. And then I will tell you what's a way ahead in Canada. And finally, I will reflect on lessons learned, things that we could do better in Canada, but also that may be interesting for some stakeholders and leadership involved with the militaries to learn on somebody else's mistakes. So, regular force in Canada, it's about 67,000, and primary reserve force 27,000. 15% of these are females. And according to the latest defense strategy, our goal is to be at 26% of females by 2025. So that's a quite ambitious goal, and hopefully we'll get there. In terms of understanding, so you saw the population survey now, who is leaving? The attrition rates in the past 5 years have been hovering between 6.5 and 8%. And you will see that, interestingly, men are red here and women are blue. Beats me, but that's fine. The attrition rates are quite similar for men and women, but when we break it down and separate medical releases, we see, and given that especially in the past 5 years, we are seeing increases in medical release, and then you can see the increase, and you can also see how it shifts that women are more likely to medically release than men. And digging through the data, the main reason for women's releasing is musculoskeletal issues, and that's a message certainly for policymakers. So here's the chart to break down the past 2 fiscal years of all releases. And as you can see, about over 40% is mental health. And of course, a significant chunk of mental health is due to PTSD. This rate wasn't like this 5 years ago. We had about 25% out of medical releases for mental health. But as you can see, that really what the message is that those increases in the past 5 years are really due to increases in mental health medical releases. And then you can see 35% musculoskeletal and the breakdown within musculoskeletal, and then of course 13% for the other. So now the military members are releasing and they are now becoming veterans. So what does the veteran population look like? So the first, you can see that the veterans of Second World War and Korean War is about 58,000. And of course, this is aging population, so the number has been decreasing every year. And then we can have, between Reg Force veterans and who have not served in either Korean War or World War II, and primary reserve, it's about 600,000. So this is given kind of Canada's population, and even though Canada is geographically a very large country, the population not so large, and it reflects on the population of military members serving and veterans. What's important to point here is that when we look at this, so these are all veterans. However, they are not all clients of Veterans Affairs Canada. About 40% of those who served in Second World War and Korean War, they are the clients, which means that they participate in any programs or services of Veterans Affairs Canada. And only 16% of the veterans who didn't serve in Korean War and Second World War are the clients. So what that means is that there is a large veteran population that is not interacting with the government department, with Veterans Affairs Canada. So today, I will focus, of course, on mental and physical health. I will talk about the partnership. What occurred to me this morning listening about establishing the new Veterans Department is the challenges in Canada in the past several years, and by now you understand that we have the Department of National Defense, when you are serving, when you are in uniform, and Veterans Affairs Canada, different government department that is taking care of veterans, providing programs and services for the veterans. So in the past several years, there were some challenges, and really it boils down to the two departments working together. And in that process, there are some cracks that some people fell through those cracks and nobody took care of them. And of course, the media put lots of attention on it. A few years ago, the Minister of Veterans Affairs had to resign as a result of it. So what's going on right now is these two departments are really trying to work together extremely closely. They established several governance committees on all kinds of issues so that the transition is as seamless as possible. I'm very proud to say that the two research groups, one embedded in national defense, and I'm here coming from that research group, and my colleague Mary Beth is here coming from research group at Veterans Affairs. We've been working very closely for the past 10 years, and I have to say that collaboration has been just amazing, like really all of the projects, and today, again, focusing on the health, I will present a number of the projects that we have worked together. So as you can see, here's the list, but I'll talk about each one of them. The first one that actually kind of initiated our collaboration, Life After Service Studies, a huge population survey. Started in the first administration was in 2010, followed by 2013, and the most recent one in 2016. Longitudinal administration. So here we are talking about, for example, the last administration, the telephone survey. We did over 5,000 regular force and reserve force veterans. So you can appreciate this is really a big population, a sample size, that the findings we can generalize and really impact the policies and programs and services. A very large response rate for us researchers, 70% is just a dream. And the next cycle will be in 2019. So today I will just highlight again health-related main issues. So the last 2016 administration, about 32% reported a difficult adjustment. Half of the population had no problem. And we heard already that most of the people don't have a problem transitioning. But again, it's a significant minority that does experience lots of issues. When we look at this population, the difficult adjustment is more common for those who are medically released. It's more common among those who suffer from chronic health conditions, who are not employed, who have less than 10 years of service, who are recently released, especially within the past 3 years. And again, with the low rank, and that's something that's consistent, that the younger, lower rank members are at higher risk for health outcomes. In terms of, so this chart here really communicates two things. One is to show you the prevalence rate for key mental health and physical health conditions, but also it shows the comparisons with Canadian general population, because how do we know that there are issues? I mean, there are sick people everywhere, but then, of course, we need to make sure that when we are talking about this particular population, to compare it to the Canadian general population. As you can see, the bars in red are mental health diagnosis conditions, and in blue is the physical health conditions. So you will see that veterans, CAF veterans, are much more likely, almost the double rate, to be diagnosed with any of the three mental health conditions, including PTSD, anxiety, and mood disorder. But they are also much more likely, almost the double rate, for certain physical conditions, including arthritis, back problems, and hearing problems. So this is, of course, controlled for any covariates to really try to compare apples to apples to make sure that these comparisons stand. So this chart shows it's kind of interesting to, the breakdown between physical health and mental health, and look at the age group. So, kind of good news that, for the age group, the mental health conditions are really, they peak for the age group 40 to 49. So things are easier, let's say, as people get older. So good news, I guess. However, unfortunately, for the physical health conditions, they keep worsening as we get older, and it's kind of as expected. A cynic might say that the physical conditions become so worse that you don't worry about anxiety anymore. But we didn't test that hypothesis, so difficult to say. While mental health conditions and mental health studies are quite common when we look at the veterans and military population, what's not studied very often is pain in veterans. And so last data, analysis were done to look at the percent of the population that deals with the constant chronic pain. And you can see 41% is quite a big number when you think about experiencing constant chronic pain, and 23% experience intermittent chronic pain. So you can appreciate the impact that pain can have on our life in all the domains. 25% reported pain interference. The factors that were associated with chronic pain were needing help with tasks of daily living, back problems, arthritis, gastrointestinal conditions, and being older than 30. The factors that were associated with pain interference, in addition to the ones that I just listed, include, of course, low social support, and again, non-commissioned member rank. Comorbidity. So again, this is still coming from the last data, life after service studies. Over 90% of those with mental health conditions also had a physical health condition. This is really an important in terms of the policy implication. So this is the group with most complex needs. This is the group like we have. So it turns out, when you do the numbers, it's about 23% of the veteran population had both physical and mental health conditions. So these are the people that need multidisciplinary medical support treated holistically, not in a silo approach. Again, of course, for this particular group is a poor quality of life, disability, and suicidality is higher if you experience both conditions. Okay, that's it for the last. Now I'm going to present another small, and this one is actually a small project, but very interesting one when we compare it to the last. So what my colleagues at VAC and my team realized that when we do a qualitative data interviews with veterans and even anecdotal evidence, often we hear kind of the comments, the veterans before the transition, but also those who just transitioned out, we hear they don't know what they don't know. So a little bit of I guess, lack of reflection of what to anticipate as they're going through the release. So we came up with an idea that maybe if we just force them to kind of, or nudge them to reflect on some of these questions that might motivate them to seek help if they need help. So of course, as researchers, we did cognitive interviews and making sure that the questions are really resonating with this population. So we created two self-assessment checklists, one for the people still in uniform serving, and the second one for those who are released, veterans. So this is linked to the well-being domain, so recognizing all well-being domains, and basically asking them really to ask themselves a question: how well they are doing, how well they are prepared, do they have the finances in order? I'm really sorry if you can't read any of those. I can't from here. But it's really looking at all the domains, including the finances, accommodation, social relationships, employment, important purpose in life. So again, an idea to nudge them to reflect, and then if they kind of score red, let's say, that would link them, that would be linked with programs and services that they might contact. So we are working closely with the policy owners to implement this. So right now, kind of a preparation package for those releasing called a journey included this self-assessment checklist as a part of all the other, like they get information about what to expect. And this has been distributed across Canada to all military family resource centers. There are about 25 of them. So for us as researchers, this is really kind of nice to see that one of our products is really being used, and hopefully it helps people. On to another topic. So most recently, veteran suicide mortality study was conducted where they linked administrative data from the Department of National Defense to Canadian mortality data at Statistics Canada for the period of 37 years, between 1976 and 2012. So the goal was really to compare the veterans more likely to commit suicide compared to Canadian general population. The results you will see overall, the risk of suicide among male veterans was 1.4 times higher than the general population. The risk was highest among males under age 25, who had 2.4 times higher risk of suicide than the general population. Male veterans aged 55 and older had a low risk, so that's a good news. And the females were also at higher risk, 1.8 times higher than the general population, and the risk was similar for all the age groups. So this kind of answered the question, yes, the suicide is a real problem among veterans and Canadian Armed Forces members, and this is something that what came out of this is that suicide prevention strategy was developed in the Department of National Defense, and people are working on different ideas and domains to address this issue. Now I'm shifting a little bit because I really wanted to kind of capture all aspects when we talk about health and mental health. So far we focused most of it on veterans, so people are already out of uniform. What we realized in the department is that people preparing to leave, and also we reflected on the increase in medical releases in the past 5 years. So we felt we needed to understand a little bit more what are the challenges for ill and injured transitioning out. So we started with a framework, and similar to Carl's proposal that the theories are really important, and we totally agree. We built the framework where reflecting on the past research, but also to help us kind of test the hypothesis and focus the research. So we started at first recognizing that the CAF members, they don't transition out alone. They're part of the CAF family, and their health and well-being is affecting CAF members' health well-being. But also, family support and care affects CAF members' well-being. And again, the other way around, the injury and illness of the CAF members might add familial demands that affect family health and well-being. So it really goes in every possible direction. And then what we have the series of transition stressors that include all kinds of stressors. The one that comes to my mind and it's been really kind of lately our focus is identity transition. I'll talk a little bit more about that. And then, of course, we have social support and coping resources that are kind of trying to buffer the impact of the transitional stressors. And then including the two departments back on the right side and the CAF on the left side, kind of providing programs and services to again, be a coping resource for the members and their families. So what we've done with this, again, tested some of the, so this is a smaller study that kind of just tested some hypotheses based on the framework. So need for care, of course, was associated with poor well-being. Ill and injured, members generally reported fair coping, so it could be better for sure, and that both coping efficacy and mastery were predicted of better well-being. As expected, social support protective against psychological distress, and interestingly, being married was actually really good for people. So it's not just that we girls want to get married, but it's actually good for your mental health. So What we also found with this particular study, this was the first time that we had data from both CAF members and their spouses. So a very first time that we can cross-reference, use couple-level data and do some analysis. Because we often interpret something about the spouses, what the CAF member said, or always just limiting kind of the interpretation of one set of data. So this time around, we had data from both population, and again, as we expected, that the CAF members and their spouses report a similar level of daily stress, but in comparison with the spouses, the CAF members had a higher level of psychological distress and a lower level of life satisfaction. And this is just to remind you, these are the people dealing with illness or injury. They are still in uniform, but on their way out. Injured CAF members' life satisfaction scores explained 45% of the variance in spouses' life satisfaction score. So for the relationship researchers out there, this is really an interesting finding, an important one to understand that we really need to look at the spouses together and the family together. And finally, at the end, when we looked at both physical, because these are the people, some were diagnosed with physical health conditions, some were diagnosed with mental health conditions. When we look at the predicting, so whatever condition they are diagnosed, predicting spousal psychological distress and caregiving burden. It wasn't the physical condition that was predicted, however, it was a mental health condition. So basically, the spouses are dealing easier with their spouses, members being physically disabled or injured as opposed to diagnosed with mental health condition. So what we are doing right now, we just collected the data with Statistics Canada did that for us on a similar kind of approach but much bigger scale. So, and we also included we approached 1,000 of ill and injured that transitioned within the past 12 months. So that was the population that we were targeting. So they're out of uniform, released within 12 months, and the goal is that we track them longitudinally every 3 years and see how well they are doing. So the first administration was 1,000 ill and injured and 1,000 non-medical release, so non-ill and injured, because we also wanted to compare and see what are the unique challenges for ill and injured population, and of course, their spouses. So the survey was just done, and the analysis are currently ongoing, and I only have one single slide because we haven't actually got access to data yet. This was done by Statistics Canada, so still waiting for access. So when these members, so this is for both ill and injured and non-ill injured, when they're presented with a list of 12 challenges that they might have experienced in the past 12 months, the top 3 they identified is finding a healthcare provider after transition. This definitely is a very Canadian issue. Might be an issue for some other countries as well, but in Canada we have a shortage of family physicians, and some provision of the healthcare is a provincial responsibility. So there are some legislative issues that finding a healthcare after they are out of uniform is quite difficult. The next is, again, really interesting, is losing military identity. So again, I have to say, 5 years ago, we didn't realize the power of that identity shift and how impactful for members it is. And of course, the third one is understanding benefits and services. And again, this is also related to having 2 departments. Some are providing different kind of programs and services, and as they are leaving, so this is their first year of release, they have to figure out who does what, because some programs and services are run by both departments. And it's important also to note, there are some, again, that did not experience the challenges in these domains, and we just want that number to be much larger than it is right now. What I also wanted, so far I've talked about all quantitative data. What I also wanted to just give you a taste of is two qualitative studies that we did recently conducted related to health. Also, I wanted to take this opportunity to highlight these programs and services. So the first one is operational stress injury support services. This program is run jointly by the Department of National Defense and BAC. And if I may say, this program has a really great reputation. It's probably due to being jointly offered. Also, this program, even though it was established in 2002, now is providing, recently was adapted to include the spouses and partners of those who've been diagnosed with mental health conditions. So my team is frequently asked to conduct kind of assessment to assess the effectiveness of different programs and services, and this is usually what we do. We do interviews and focus groups with participants, but also providers. A kind of a typical approach. So this one, again, very positive results, focused on the shared experiences, social connections, increased access to support. But also I have to say that even though I didn't include it on the slide, there are some recommendations how these programs could be improved. And this is a beauty that we provide to the program owners, those recommendations. Similar one, this is for those diagnosed with either a mental or physical condition. Soldier-owned program, focus on physical activity and sport. Again, very positive results. Those who participated, of course, any program that will force us to be more active is a good program. But again, what was emphasized is interpersonal interactions and benefits of being a part of the group and sharing the similar stories and being support to each other. So, a way ahead for Canada. So, as by now you realize, we found the transition process is complex and hard to navigate. The challenges outlined included availability services in timely manner, and it's also difficulty in understanding and assessing eligibility criteria. So that's something. So obviously, D&D and BAC must coordinate, and they've been doing that. They've really been doing that. And also what we found in conducting these research studies, within defense, we had this kind of different groups doing different things. So a little bit of, again, silo approach that the member is expected to navigate through who provides, this kind of service if you are if you are ill and injured, if you are releasing non-ill and injured, you go through a different. So we recognize the challenges, our leadership recognizes the challenges, and as of November this year, we will have one-stop shop, one transition group. So what used to be called Joint Support Personnel Network for focusing on ill and injured, now it's going to be one group that will, and as a three-star general would like to say, one dog to kick, one group that will provide the transition for everyone. So hopefully that will bring some streamlining. From the research perspective, we need to identify more systematically the critical issues and ideal phases. So many of the challenges I mentioned today, I'm sure you heard them from other countries, but what sometimes is lacking is we need to understand what's required at what stage of the transition. And again, the last one is bringing back that issue of identity. We really need to, we kind of conceptually understand, yes, it's difficult and to shift because everything the military does is socializing that identity, and then you have to kind of reverse that. And the question is, how can the military and BAC assist members to successfully manage identity shift? And what does success look like when it comes to the identity shifts? In terms of, I felt, because I do come from research organization, I felt it's important also to say, these are some of the things that we've done well, and of course there's always room for improvement. What's really important is to increase trust of all stakeholders, including employees and the public, in the credibility and reliability of veteran research and scientific activities. And how we do that is really by doing these three things. The first one is to ensure that we conform to the scientific excellence and that our research is of the highest quality, following the norms of rigidity in scientific methodology and all the ethics approach when it comes to research. We also need to do it timely, because when I meet with a client and they have a question for me, and if I say to them, sure, I'll have the answer in 3 years, they roll their eyes, like, seriously? And yes, research does take some time, but we should be cognizant of the time issue. And the last one, to ensure that the conduct of veterinary research and science and any research or scientific product, as well as any associated communications, are free from political, commercial, client, and stakeholder interference. To the extent possible, I would just add. We understand it's not just the research that provides the effective policies and programs and services. There are other contributing factors, but it's important that our research stands the challenge of integrity. What we could have done better, and I wish we could do this better in future, is stronger focus on integration. So we need to understand that the research is important source of evidence that must be appropriately considered in evidence-based decision-making. We also need to enhance leadership understanding of the potential contribution of research and science. And we have, as researchers, we have a role to play in when we speak at different forums. We should use the language that speaks to that particular audience to understand, to enhance their understanding of the research. This is not only to be done after the fact. We also have to be included at the program, at the problem definition phase, but we also need to play a role in providing not only on the research required to resolve today's issues, but also to understand emerging scientific issues, research directions, and opportunities. And I would conclude with that. Thank you.